The newsday continues here on One News Now. I'm Riza Diaz. COVID-19 cases in the country are once again on the rise. Over the past 2 days, new infections returned to the 2,000 mark after consistently staying below that threshold for months. New confirmed cases on Thursday were at over 2,200, while new cases on Friday were at around 2,600, the highest logged in 4 months. Now, this pushed the country's total caseload to over 571,300, of which more than 34,400 are active cases. Now, to help us make sense of these numbers, we have Octa Research Fellow Professor Guido David. Professor, good morning.
Hi, good morning again, Risa.
Sir, what attributed to this increase in cases over the past 2 days?
Well, first we'd like to clarify that this is a genuine increase. In fact, this could be the start of a surge in NCR. Sometimes, we look at, when we look at numbers, sometimes there are increases which look like these are just clusterings or temporary spikes or something which, could be short-lived. But this is a genuine increase, and we're seeing it, in several LGUs in NCR. This is not something that could be attributed to, let's say, the Valentine's Day or Chinese New Year, because it's a sustained increase. So we think there's a possibility that a variant is spreading here. We know that the variant is already in Metro Manila. Now, before some people say that, we don't have evidence that, yes, it's correct. We don't have evidence, but based on the trajectory of the increase, this is similar to what we saw in Mountain Province, in Benguet, and in Cebu, where the variant was already also found. In fact, before they identified the variant in Cebu and Mountain Province, we already theorized that the variant must be spreading there, though we did not have the evidence in terms of genome sequencing. But there is the trend in the new increase in cases that strongly suggests that maybe a variant is spreading in the area.
Professor, please clarify, do you already consider this as a surge, or is there a cause for alarm already?
This is actually a cause for alarm because it's rising quickly. It's increasing quickly, and we commend the local governments of Pasay for instituting a localized lockdown immediately. But it's so far, what we're seeing is that curbing this increase so far has proven to be difficult, and that was the case also in Cebu. Now, there might be a formal definition used by the Department of Health for a surge, but this is definitely a concerning increase. If we don't call it a surge, it is at the minimum a very concerning rise in new cases in Metro Manila.
Sir, based on the information that you've gathered, which areas have recorded an increasing trend in cases?
Well, there's Pasay, of course, and then there are other LGUs, even Makati. We're seeing an increasing trend, and there are some which are slightly increasing. We're also seeing it in Manila and Quezon City, although the rate of increase in Quezon City is not as fast as in Pasay City, but we are also seeing bigger numbers in Pasay and in Manila and Quezon City and Makati. In fact, the average number of cases we had over the past 2 days, when we registered 2,000 plus in the Philippines, is we're seeing 900 cases per day in Metro Manila, and the average over January is just 400. In fact, less than 400 cases per day in Metro Manila. And for the past 2 days, we're seeing 900 cases per day. We don't expect that to decrease, drastically soon. There are going to be fluctuations. So tomorrow or today, it might not be 900. It could be down to as low as 600. But the average is about close to 700 cases now per day in Metro Manila.
Sir, given these numbers in consideration, will this affect the country's vaccine rollout?
In terms of the rollout, it should not affect the rollout right now. What's more concerning about the rollout is the willingness of people to be vaccinated. That is the main concern. Because right now, hospitals are not full yet in Metro Manila. In fact, the capacity is, the occupancy is still good, because even though we're having an increase right now, there is a delay before hospitals reach or start. Hospital occupancy will start increasing dramatically. So we don't expect hospital occupancy to be full, within the next month, within March. So having said that, the vaccine rollout is important, and it's concerning that there is quite a lot of resistance that we're seeing against this vaccine program, which would really help our pandemic management.
Well, thank you, Professor Guido David of the UP Octa Research, as always. Maraming salamat po. Mass vaccination in the United States has driven the decline in COVID-related hospitalization and deaths. How did this happen? Johns Hopkins Bloomberg School of Public professor and virologist Andrew Picosh will tell us more.
That's the $10,000 question, isn't it?
$10 trillion?
What we're trying to get at is the modelers tell us that a population immunization rate close to 70% is what's going to get us to a very manageable rate. Now, that's incremental. As we move to higher percentages, we'll have less and less numbers of cases. I still think that given the current rates here in the U.S., we're talking about a late spring, early summer before we can really get to a level of immunity in the population where we can safely consider to really let up all on many of the restrictions that we have right now.
Well, late spring, early summer, that's actually sooner than a lot of people are saying. I'm wondering from your perspective whether the sort of naysayers out there who are saying stay on with your masks, keep social distancing, even as we do get some immunity building up in the community, whether they're worrywarts in the people who are like, look, we just need to live again, are actually right, that there is a level of immunity that's building that's allowing that to happen more safely. I mean, what's your view on that?
I think we have to think of these public health interventions as, again, a multi-layered approach, and the focus is going to be on trying to remove the ones that are having the greatest impact on our economic and social lives. So, to be honest, masks should be something that we should just get used to wearing for a while, because those are the simplest ones that can be in place that can maintain a level of reduced transmission. What we really want to focus on are things like, schools, on getting people back into their workplaces and finding ways to use the vaccination as well as contact tracing and mask wearing to allow us to open up those aspects of the economy so that we can get to some level of normalcy there. So think about this as layered.
Professor, let's talk about how we should handle those that have been vaccinated, and not from a political standpoint, from a scientific standpoint. I think from a society point of view, there might be a worry about creating a two-tier society in the meantime. From a scientific standpoint, Andy, is there any reason why those that have been vaccinated and have waited several weeks after the second dose can't just go about life as normal?
So far, the signs suggest that these vaccines, particularly the Moderna and Pfizer vaccine, which have been the most studied here in the U.S., certainly point to having a really strong immunity, and it points to having reduced case numbers as well as that massive drop in the severe cases. So I still think that we want to maintain a group effort here. Masking is going to be something that is going to be needed. And if you're vaccinated or not vaccinated, masking is going to help us in terms of limiting cases. We also want to stick together on some of these issues. And again, masking is a very easy way to make sure that we maintain that feeling that all of us are still in this together and all of us are fighting this pandemic in the best way that we can. So I would imagine that masking is something that, whether or not you're vaccinated, you want to make sure to keep that up for the next few months.
From your standpoint, though, do you think it would encourage vaccine take-up when we really need the encouragement to allow those that have been vaccinated to go about life as normal?
Yeah, it's a difficult question to get at because, as you mentioned, you don't want to generate a two-tiered society here. But certainly one has to think about, as a larger percentage of the population gets vaccinated, those individuals should be able to be doing more things, whether that be going back to school, whether that be going back to work. There should be some benefits from going out and getting your vaccination because you really are going to help reduce the level of transmission of this virus in the community if you get yourself vaccinated. And that's going to have a general population benefit.
Meanwhile, Malacanang announced we'll be having fewer holidays this year. The palace announced the holidays for 2021 through proclamation number 1107. Notably, November 2, December 24, and December 31st are now special working holidays. This is to, quote, encourage economic productivity by minimizing work disruptions. That means said holidays will be considered as a normal working day for employees and no additional pay will be meted out. There are 10 regular holidays, 6 special non-working holidays, and 3 new working holidays for 2021. The President will issue separate proclamations for Eid al-Fitr and Eid al-Adha. We'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. The National Capital Region will remain under general community quarantine for the whole month of March. Presidential spokesperson Harry Roque said President Duterte approved the new quarantine classification for next month. Other areas that will also be under GCQ are Batangas, Apayao, Baguio City, Kalinga, Mountain Province, as well as Tacloban, Iligan, Davao City, and Llano del Sur. The rest of the country will remain under modified GCQ. Roque also announced that travelers will no longer be required to undergo testing except if the LGU of destination will require RT-PCR testing. Domestic tourists are also not required to undergo quarantine unless they exhibit symptoms upon arrival at their destination. Roque also said that minimum health standards shall be strictly implemented across all settings. Travel authority and health certificates are also not mandatory for travelers. Mabuhay Zamboanga Sibugay Vice Mayor Restituto Calonge was killed yesterday afternoon in front of the Municipal Hall. According to PNP Regional Office 9 spokesman Captain Edwin Duco, the assailant has yet to be identified. He says police reports disclose that Calonge was shot at around 3 o'clock in the afternoon in front of Mabuhay Municipal Hall. Let's get more update on the situation in Zamboanga. We have with us Police Captain Edwin Duco of PNP Regional 9 via StreamYard. Sir, good morning.
Good morning, Ma'am Diaz.
Sir, first things first, may update po ba tayo on the investigation? Is the assailant identified already and is in custody?
Yes, after several hours of investigation and conduct of interview to the bystanders who have witnessed the violent killing, they already have identified the suspect. The suspects.
Sir, you mentioned suspects. Are they also in police custody?
Not yet because they were able to evade. No, they use an XRM motorcycle as their getaway, and then it took the investigation several hours before those assailants were identified. So they have left the area and hide in the hinterlands of Zamboanga Sibugay province.
So, sir, since you mentioned they've already been identified, is pursuant in place?
As of this time, the police operation is still going on, led by Police Colonel Albert Capaccio Larubis, the Provincial Director of Zamboanga Sibugay province.
Based on investigation, sirs, what are the possible motives for the attack?
Ma'am, sometimes we refuse to disclose the motive in the public because it's only a part of investigation. But we believe that the motive is somehow connected with his job as a vice mayor, of course.
Well understood, sir. Were security measures, sir, in place before this incident? And now in the line of this event, will there be security upgrades in the municipal after, of course, what happened?
Yes, ma'am. This is a matter that should be properly mapped out by the security cluster of the province, especially that election is fast approaching. No? We want to ensure that the areas will be equipped with CCTV cameras. I'm not even sure if they have, but I believe they have because it is a very good aid in identifying the suspects. So for crime solution, that is very material. That's why, as of now, we believe that the provincial director will furnish sufficient security for especially the candidates or any person who will participate in an election if we anticipate that there is an impending violence during election. But for previous election, our areas here has not reported any election-related violence.
Well, thank you, sir, for all those information and for your time. That was Captain Edwin Duco of PNP Region 9. And those are the top stories of the hour. Join us later again at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.